Hello, I'm excited to share with you some of the preliminary findings of the 2022 Needs Assessment. We want the Resource Center to be responsive to our audience's needs and preferences for education, resources, and training. To achieve this, we are using the social marketing theory to guide our efforts. The social marketing theory is a program planning model shown to be effective with programs serving the older adult population. A key principle of the social marketing theory is using upstream communication or having the target audience tell the program or organization how it needs to adapt or innovate for there to be behavior change. Step one is the crucial step of obtaining information from the target population, including their unique needs and preferences regarding the program. This feedback will then guide program planning efforts, steps 2 and 3, and the implementation, step 4, will be evaluated, step 5, to further refine the program, step 6, and the cycle continues. The long-term goal of conducting this needs assessment was to better understand the contributing factors for nutrition services program support as a means for the Nutrition and Aging Resource Center to best serve the National Aging Network. The goal was to hear from about 600 to 1,000 current and potential Nutrition and Aging Resource Center users identified as anyone in or impacted by the Aging Network. Inclusion criteria consisted of being at least 18 years old and able to read and understand the online survey. The online survey was comprised of 91 questions about service area, respondent general information, aging perspectives, including aging knowledge, aging expectations, and ageism, ACL center awareness, programming training needs and preferences, COVID-19 service impacts, and socio-demographic data. The survey questions were based on the evaluation objectives, which were identified through the principles of the social marketing theory. Multiple expert groups reviewed the questions to ensure validity, coverage, and clarity, including the ACL, Iowa Department on Aging, Iowa State University, and the Research Institute for Studies in Education, or RISE. We received nearly 2,700 responses. We were concerned that some of these may have been bots given undeliverable email addresses and requests for compensation. Yarish and others defined bots as humans or computer programs looking to receive the survey's incentive. RISE completed the data cleaning. The main goal for data cleaning was to remove invalid responses from bots or inattentive respondents. The inclusion criteria for cleaning is listed on the right-hand side of your screen. After noticing many similar responses in our data, we examined other data sets that did not contain any bots. 85% was the greatest degree of similarity between any two respondents in these data. The other data sets were from more homogeneous populations and thus, theoretically, should have a higher degree of similarity. Therefore, we felt 85% was a good cutoff to use. Survey completion needed to be more than 60%. This is a technique that RISE found in the literature. This cutoff is more about taking out lower quality responses, but also likely caught some bots. Another criteria was completion of the survey taking less than 7 minutes. This measure was meant to take out bots and low quality responses. Doing the survey in less than 7 minutes means that someone took less than 2 seconds per item. After the cleaning, the final sample size was 1,910. This was 191% our goal response rate. Now for the fun stuff, our results. The survey respondents were mostly white, non-Hispanic females. The majority of respondents were educated and had 6 years or more years experience working with an Older Americans Act funded program area. Of note is 1 in 5 respondents reported being in the aging field for greater than 15 years. Responses were received from all 10 ACL regions and were evenly distributed. The service areas were more rural and urban compared to the U.S. neighborhood distribution. 3 out of 4 respondents reported that they served a different neighborhood type than the neighborhood type where they lived. 2 out of 5 respondents reported providing services to 1,000 to 5,000 clients annually. 2 out of 3 respondents reported that they had management responsibilities. Still, there was a range of job duties reported. This is important as we think about material development, particularly training, as each has different responsibilities. Almost all, 86%, felt their primary education or training prepared them for their job. However, the Aging Perspectives data share a different story. Insight into the aging perspectives of those who serve the older adult population is necessary given the detrimental impacts ageist views have on an aging person's physical and mental health. The scores for each area were low, suggesting low aging knowledge, moderate ageist viewpoints, and moderate aging expectations. There's perception that they were prepared for working with older adults, and these low scores may suggest that the training received took more of a deficit view of aging rather than a positive one. For example, teaching that pain is normal when in fact it is not a normal aspect of aging. Based on the Aging Perspective findings, we are actively working to help the National Aging Network combat ageism through awareness, education, and resources. We recently provided a 2-part ageism webinar series. We are applying Reframing Aging Framework to our Resource Center products and presentations, and we are promoting non-center training opportunities to expand the aging knowledge among National Aging Network. The top goals for the respondents' organizations included increasing participation, implementing innovative programs, and connecting with healthcare. This is where the innovations in nutrition projects are so valuable. Respondents were asked whether they had received grant funding of any kind for innovative work. Those who responded yes completed follow-up questions. Almost 1/2 of respondents indicated they received funding. Of those who had received funding, 20% indicated that ACL was the funder. Other funding sources included local organizations and other state agencies. The top 5 innovations project focus areas were meal delivery, focus on populations with limited incomes, nutrition education, evidence-based programming, and social isolation. 2 out of 5 had not received innovation project funding due to the lack of staff time, funding, awareness, and knowledge. Other barriers were not seeing a need for it, unsure of where to start, and not having research experience. The Nutrition and Aging Resource Center is actively working to address the barriers towards applying for innovation funding. Some steps we have completed or are completing include creating a Quickener with Dr. Nandita Chaudhuri and myself talking about the benefits of the Innovations in Nutrition grants. We are creating lightning talk videos. So at the 2022 Innovations in Nutrition annual meeting, Iowa State University filmed lightning talks for all grantees present. These videos will highlight each Innovation in Nutrition project and be shared on the Nutrition and Aging Resource Center website and social media platforms. The goal of these lightning talks is to help website visitors to learn more about the types of projects that the ACL funds, as well as to help promote awareness of projects that could be replicated in other areas. We also developed a template for and conducted a training on completing a capstone project report. This session was filmed for future training opportunities as well. We are also providing conference presentations and sessions about the Innovations in Nutrition grants with current and past grantees sharing their experiences. The 3 most utilized websites for health and nutrition information were the Administration for Community Living, National Council on Aging, and the Nutrition and Aging Resource Center. Interestingly, although the Resource Center was identified as one of the top 3 websites for nutrition and health information, 2 out of 3 reported very low to moderate awareness of it. About 3/4 of the respondents indicated they have used the Resource Center. However, we did not collect information about their experience when they accessed the Resource Center. This is something to consider as we move forward with revising and updating the Resource Center. About 2/3 of respondents reported that they were accessing the Nutrition and Aging Resource Center website via their computer. Knowing how they're accessing the center is important when we think about our website design. For those who had not utilized the Nutrition and Aging Resource Center, the main barrier was not knowing about it. The Nutrition and Aging Resource Center is a valuable resource for the Aging Network, researchers, extension, and community members. We want to make sure the public knows about it. The Nutrition and Aging Resource Center team is addressing the lack of awareness by leading sessions at national conferences such as the National Health Outreach Conference, Society for Nutrition Education and Behavior, and Food and Nutrition Conference Expo. Designing and purchasing promotional materials for sharing at outreach events, such as pens, notepads, and travel mugs. We're wearing name tags with the Nutrition and Aging Resource Center logo for team members when presenting on behalf of the center. And we're promoting Resource Center training opportunities with outside agencies and organizations, such as universities, professional groups, and other organizations. We're also establishing a social media presence using the platforms most used by respondents. The leading training needs identified were program evaluation, Technology for Older Americans Act programs and participants, navigating network partnerships, business acumen, funding diversification, and diversity, equity, inclusion, and access. Respondents rated their familiarity and interest for 56 nutrition services program relevant topics. Based on these findings, we are focusing on high interest and low familiarity topics. This slide illustrates where each topic was in relation to the rated interest and familiarity for the Aging Network. It is important to note that no topic had a mean familiarity score lower than 2, which reflects being somewhat familiar. Our efforts are concentrating on the upper left green quadrant indicated with red stars. 2 out of 5 respondents claimed time was a barrier to training participation. 1 out of 3 reported scheduling conflicts, expenses, and access, such as it not being offered, as limitations for engaging in training and/or continuing education. Using these data, the Nutrition and Aging Resource Center team is developing an asynchronous 10-module online course. It is being developed using a Canvas platform and will address the topics identified as low familiarity and high interest. Part 1 will discuss programming, participation, and promotion, business management, including running a program, partnerships, and menu planning basics. Part 2 will entail targeting those at greatest economic and social need, working with older adults, business management in the area of personnel management, menu planning or meeting your client's needs, and diversifying funding. Preferred training platforms were live webinars, live online courses, and face-to-face conferences. One survey section was dedicated to understanding the preferred formats and methods for the Nutrition and Aging Resource Center resources and service delivery. Respondents were able to select multiple responses for this section of questions. 1,792 completed this question. For longer continuing education and training, the 3 leading preferred formats were live webinars, live online course series, and face-to-face conferences, as indicated as the red bar on this slide. We also inquired about the formats for relaying quick information from the Aging Network. Email was the most popular method from a peer-to-peer listserv. This slide shows the preferred print media formats. The top two are 2 to 4 page handouts and newsletters. The Nutrition and Aging Resource Center is working on our portfolio of printed resources using a variety of templates, such as short handouts, infographics, FAQ sheets, etc. There were many nutrition, physical activity, and general health information sources from which respondents could choose. Those that received less than 10% of total respondents utilizing it were excluded from this figure. This included television news channels, Pinterest, talk shows, and Snapchat. The most reported information source was Facebook. Since Facebook was the leading source, the Nutrition and Aging Resource Center is focusing on providing research-based nutrition, physical activity, and general health information on the Resource Center's Facebook page, as well as our other social media platforms. Facebook was the top response for accessing nutrition and health information. It was also the most utilized, with 73.5% of respondents using it. The other social media platforms used were Instagram with about 26%, LinkedIn another 26%, YouTube 20%, and Twitter at about 20%. However, all platforms had at least 200 responses. The needs assessment reaffirmed the Nutrition and Aging Resource Center's outreach strategy. This includes a monthly e-newsletter to keep recipients informed of resources, training opportunities, and policy updates. We are also actively planning annual webinar series to address the identified training needs that are not being addressed by the ICANN Endeavor or by the ACL. Finally, we are active on all social media outlets. We anticipate that our numbers will increase as we continue to promote the Resource Center. These results have provided us with a unique glimpse as to the needs and preferences of the aging network nationally versus a specific state, city, or program area. This is enabling us to focus our energy on outreach efforts that will serve the vast majority of the network. We are finalizing an evaluation plan to measure the impact of these endeavors and to identify any areas for further improvement. The finalized plan will be integrated into the preliminary logic model developed prior to this analysis. Thank you for your time today. A full report will be available on the Nutrition and Aging Resource Center website.